I'm Dave Colby. I'm 63 and I'm from Central Ohio, Columbus area. I ran my first half marathon at 42, early 2000s, about 2004. I got scuba certified, and then I was so enthralled with that that I just worked straight into becoming an instructor. Just recently retired from being an instructor, but I still actively scuba dive. I still do my trail runs. Yeah, it's just, I've always been an active person. In late 2015, I started getting a tremor in my left hand. So I went to my family doctor and he thought it might be just an essential tremor and he wanted me to go see a neurologist. My first experience with a neurologist was not a good experience, and the more people you talk about with Parkinson's disease, there's far too many of those. The protocol from the doctor was not caring. It was very matter of fact and blunt. I remember going back to my office afterwards at that point, and my wife was in the office, and she goes, "Well, how did the doctor's appointment go?" And I said, "I have Parkinson's disease." Both of us kind of broke down. It was scary. We didn't know where that was going, what to expect. I was kind of a denier for several months, saying that I was going to beat it. I was experiencing rigidity, stiffness in my left side, my left leg, my left arm, and I was also experiencing a lot of insomnia, which is both Parkinson's symptoms. I just didn't know if there was something better out there. The special came on 60 Minutes about this place, R&I, and what they were doing here. It piqued my interest. I got an appointment here. It was unbelievable, the treatment I got here. They tested me for so many different things. I did neurological tests, cognitive tests. They did an MRI. They sat and talked to me. I met with Dr. Razai. After all that, I actually met with Dr. Ann Murray and just didn't realize the amount of care was available. There's no exaggeration. She spent 2 hours with me, digging into my history, digging into what I'm going through, what I want to do with my life, what I expect to do with my life, and how we're going to treat that. When I left, I said, "Does this mean that you'll be my neurologist from now on?" She goes, "Will you let me be your neurologist?" I said, "Absolutely." And I said, "Can I give you a hug?" I just gave her a big hug because I just didn't know that that was available out there. That's here. They're at the top of the ladder on research. Anything coming up that it could possibly help me, I know that I'm going to be first in line to know that just because I'm a patient here. I have my own construction company, Colby Construction Services. With being on the right dosage, I can feel the difference. I notice the difference, and I can sit in construction meetings now. I can address company owners and so forth with no hesitation at all. Where before I would be shaking so bad, I'd be kind of embarrassed to try and do it. I've seen a lot of Parkinson's patients give up, and they sit in front of the TV and can't move. And it is hard. There's no doubt about it. It's hard when you get older to keep working out, whether you're healthy or not. Dr. Murray was the one that actually put in my head that there's no reason to even think about slowing down. Keep doing what you're doing. Don't give in. There's no reason for you to stop doing the things you want to do. It's inspiring. I have a future. I would say to anybody out there who's had those similar experiences, don't give up. And I would highly recommend coming to WVU first. What a great place this is for the treatment of Parkinson's and movement disorders. You'll find no better care in the country that I can even imagine.